welcome you to our program today. Our special guest is Dr. Jeffrey White. He is a physician at Medical Associates Clinic in Platteville, Wisconsin. And so, Dr. White, thank you so much for coming on the program this day.
Happy to be here.
Yeah, and so Dr. White is going to be talking about the death of Jesus. And so I think this is going to be very interesting from a physician's standpoint as far as, just exactly, how Jesus died from a medical perspective. But before we get into that, and I should also mention that Dr. White is my personal physician, and so I do want to thank him. And so I would say that the reason why I'm somewhat healthy today, a big reason for that is Dr. White, and so thank you. Okay, well, you grew up in San Francisco, California, didn't you?
I did.
And so how did you follow the yellow brick road to Platteville, Wisconsin, so to speak?
So I chose medical school in Des Moines, Iowa, mainly because I knew a physician very well who was a student there himself, and he told me about the school, and I thought I would apply. I got in, I interviewed there. I thought it was the best match for me, although very far away from home, and so I chose that route and met my wife while in medical school, who is from Dubuque originally, and so that's mainly how I ended up here, versus California.
Yeah, so it's nice that she's kind of in the home area here, and so you have your wife and you have some children too?
Two kids, yep.
Yeah, very good. Yeah, well, today we are talking about the death of Jesus, and I know as a physician that a lot of your work is to think about wellness and health and getting us going in the direction of life, and so in many ways I would think death is kind of going against the grain then, as far as a physician thinking, well, no, my job is to make everybody well. Yeah. But still, for all of us, we come to that realization that we are mortal people and that death does come to us, and I would think that that's got to be one of the tough things, I would say, for your, being a physician, is to have to give that diagnosis of a terminal illness to a patient. Are there any things that you can say that would bring comfort, that are kind of helpful in those times when that day comes?
Well, the first policy I have about telling someone that they have terminal illness, or telling a family when a loved one is in a hospital bed dying, is that I'm honest. I believe that there is really no room or space for any sort of padding around the issue. I believe that being direct and telling someone exactly what is happening, not only from a mechanical standpoint to the patient, but also from a spiritual standpoint, how their death is inevitable, and what I can do as a doctor to help that death be as comfortable as possible. One thing that a lot of people fear with death is that it has to be painful, or it has to be awful, or that moment when you're dying, that fear of the unknown, what is going to happen to me. But in reality, in many settings, if you don't die at home in your sleep, or in some setting where you're not around a physician, in a more controlled environment like a hospital, for example, we in the hospital do a lot with families and patients to ensure that the process of death is very well understood, and everybody knows what to expect going forward. The same can be said for the hospice organization out there. There's multiple hospice organizations, but similarly, they work with patients who are dying, who have decided that death is something that they are not running away from, but they're just going to let happen, or they're not necessarily inviting it, but they're not going to stop it from happening if they can help it. So it's part of the whole spectrum of life. I mean, we have conception, and then life, and then we have death. And to ignore death because it's a difficult topic, or it's fraught with anxiety and fear and anger, all the usual emotions, would be a disservice to the patients out there that I serve. And even this morning I had a discussion with a family about their loved one's impending death in the hospital. It happens very frequently, So after doing this for a long time, I have a method about it. I'm just a human being, and I try to speak at their level. Just if it were my father or my mother laying there in bed, or my brother or sister, that's how I look at it. Yeah.
Yeah, that's one of the things about death, is that if there's one of those things that as humans we want to do is try to deny it, but that's the reality of it is. And so your approach is to say the best thing is to be honest, and this is where we're at, and then by that we can, we can come to an acceptance of it. And that's one of the things that Jesus was doing so much. He was preparing his disciples and followers as far as his death, and he was telling them many times, but yet I think there was always this denial, maybe because of who they thought Jesus was as far as the Messiah and what kind of a Messiah he would be. So I thought today, now in all the gospel readings there is an account of Jesus' death, but I thought I'd read the one from John chapter 19, verses 28 through 37. Later, knowing that all was now completed, and so that the scripture would be fulfilled, Jesus said, "I am thirsty." A jar of wine vinegar was there, so they soaked a sponge in it, put a sponge on a stalk of the hyssop plant, and lifted it to Jesus' lips. When he had received the drink, Jesus said, "It is finished." With that he bowed his head and gave up his spirit. Now it was the day of preparation, and the next day was to be a special Sabbath, because the Jews did not want the bodies left on the crosses during the Sabbath. They asked Pilate to have the legs broken and the bodies taken down. The soldiers therefore came and broke the legs of the first man who had been crucified with Jesus, and then those of the other. But when they came to Jesus and found that he was already dead, they did not break his legs. Instead, one of the soldiers pierced Jesus' side with a spear, bringing a sudden flow of blood and water. The man who saw it has given testimony, and his testimony is true. He knows that he tells the truth, and he testifies so that you also may believe. These things happened so that the scripture would be fulfilled. Not one of his bones will be broken. And as another scripture says, they will look on the one they have pierced. Now, of all the ways that a person could be put to death in terms of capital punishment, and I think back in those days there was stoning, there was beheading, but here it was crucifixion. And so, of all the ways, why was Jesus crucified?
Well, from my own opinion of the matter, I can't think of a more demeaning way to die, to be hoisted up on a cross in front of crowds. People who were stoned or killed otherwise, they may not have had that visualization that you would have, kind of a spectacular type of approach. So that is one thing. But well, crucifixion is also a surefire way to kill somebody, and it's also horrible torture from a physiologic standpoint. It's an awful way to die. And my guess would be the animus toward Jesus by his persecutors must have been pretty severe in order to choose that method of death.
Yeah, here again, I can't imagine any way of dying is pleasant.
No.
But crucifixion, like you say, the pain must be just
enormous. Yeah.
Outstanding as far as just the pain that Jesus suffered as this was happening. And so I think about, as Jesus was dying, he became thirsty. That's one of his final words, is saying,
right.
"I am thirsty." And so is that common amongst the dying, that all of a sudden they have a deep thirst?
Yes. It depends on the death, of course, but in the case of the crucifixion, I'm again postulating here, but I believe that probably what happens with the crucifixion is you basically have so much weight on your diaphragm, which is the muscle that moves the lungs, that you can't move the diaphragm. So you have to breathe using the muscles of between your ribs, the intercostal muscles, in order to hoist yourself up to get a breath in. And over time, you get exhausted. So panic sets in when you can no longer push your body up to obtain air, because the diaphragm, again, is so compressed by your overall body weight based on the posture that you're in on the cross. And so what occurs is a physiologic phenomenon called sympathetic response. There's two nervous systems in the body that compete at the same time. One's called the sympathetic nervous system, the other is called the parasympathetic nervous system. The parasympathetic nervous system basically controls things like the diaphragm, the heart, the intestines, things you don't have to think about. The sympathetic nervous system is the one that controls the overall, what we call fight or flight, where when you're in a hurry or you need to get somewhere, or you're very nervous about something, you might have excessive sweating, you might have excessive over response. And in Jesus' case, I can only imagine that there was a bit of panic setting in there, just as a natural response to his imminent death, which would result in him feeling thirsty, because one of the symptoms of an oversympathetic response is excessive thirst. It's very common for people to be very thirsty. So like you see people giving speeches, for example, or debates, and they might need a glass of water while they're talking. Well, they might not need a glass of water 40 minutes ago before the debate. They probably didn't need a glass of water, but they're up there talking. Their sympathetic nervous system is firing away because they're nervous. Their mouth gets dry, and suddenly they can't speak very well anymore, so they have to have a glass of water, right? So that's probably why he was thirsty. And it is a common response among the dying who are conscious of their death and conscious of what's happening to them, which is one of the horrible things about a crucifixion, is your brain is fine. You're not sedated, you're not, unconscious until the very end, until your body no longer can supply oxygen to the brain. So.
And then I noticed what the soldiers did then is they took a sponge and put it in this wine vinegar solution or whatever, and they had it on a hyssop branch. And what was interesting about that, at least from a biblical standpoint, is the Passover, they had a hyssop branch that they dipped with blood, and that's what they put on the doorpost. So it was the Passover lamb that was the blood of the Passover. So here again, this would be some prophetic fulfillment, that Jesus is now the Passover lamb. But still, there was this idea here that with soldiers, that it sounds like that was a common practice, that they would offer, of all things, then this wine vinegar, which would you think this would be like a pain retardant or not?
No, not a pain retardant. The only thing I can think of, vinegar obviously it's not something we go around drinking very often. So the only thing I can think of that with the vinegar would help is it does stimulate salivation. So if you put vinegar into your mouth, you might salivate a bit more than you normally would. So maybe it was to stimulate salivation so your mouth would not feel as dry. Otherwise, to me, it would seem like even worse torture to get something put in my mouth that tasted that terrible.
So that's all part of the torture. Here, I almost want to believe that somewhere along the line that somebody wanted to show mercy.
Yeah.
But as I listen to you and think about this, no, this was just more insult, more punishment to say, "Oh, I'm thirsty," and so
I think so.
This is the worst thing that we can give you at this time. That's just going to even make your thirst even worse.
I can't imagine water was not available there at the time. That would be the natural substance you would bring towards someone's lips, would be like a rag soaked with water that the person could, maybe squeeze out or something. I don't know, but no, vinegar to me would seem like you're expecting water and then you get vinegar, right?
Yeah. And this is why we have the doctor on today, because I think I would have misled you all in the wrong way, saying, oh, there was somebody that showed a little mercy to Jesus when he was being crucified, but there was no mercy to be shown.
I don't think so.
Oh, you're thirsty. Well, we're just going to make it even worse now and add to the torture by... Okay, well, let's flip it around a little bit when we think about death and dying today, that... obviously you're a man that shows mercy, and so when we think about people who are dying, naturally our bodies have a lot of pain when we're dying, and so that's, I think, a lot of the care today is to try to manage pain and comfort. And so what would be kind of a good pain management plan for somebody who is terminally ill?
In terminally ill people, you respond to what they need. So if you're conscious, you're talking, you're going to say, I have this pain due to, I have pain in my bones, I have pain in my skull, I have, abdominal pain, whatever the pain is. And then there's different choices of medications based on where the pain is located. If someone is on their deathbed and they're very agitated, but yet they're not conscious, and yet you worry that they're in pain because even though they can't tell you, then we tend to use the more powerful narcotic medications that are available on the market by IV form or droplet form that can go under the tongue. Hospice in particular uses a lot of droplet form morphine primarily. They also use patches sometimes, but really probably the key medication used by hospice if you're in home and you're having a lot of pain is a droplet form of morphine that very concentrated, where you can put 1 drop or 2 under your tongue, and that controls your pain for several hours at a time. So if you're able to swallow pills, then occasionally they'll use pills as well, but usually at the very end of life you're not able to really swallow pills either. So droplets get used, and it absorbs through the tissue under your tongue, yeah, for the pain aspect.
Yeah, so that's really a high priority. Comfort and care is making sure that the pain is controlled, and depending upon if a person's conscious or unconscious, just having a sense of what needs to be happening here to make sure that nobody's suffering, even if they're unconscious at this time.
Right, and the anxiety that goes with the approach of death is also real. So there's also a liquid form of an anxiolytic medication that is commonly used. One example would be lorazepam, is a very commonly used medication for short-term anxiety relief in acute cases, and in hospice or even in the hospital if we don't have an IV, we will use droplet form lorazepam, similar to the morphine droplet form I was talking about earlier for the anxiety aspect of death. Yep.
Yeah. Well, crucifixion. I think about the word excruciate, that literally means out of the cross. And so we're talking about Jesus being crucified, a very painful death, arguably maybe considered to be the most painful way that a person could die. And so when I think about his death, there were 2 other people that were crucified with Jesus. They oftentimes refer to them as being the 2 thieves that died with Jesus. And well, it got to a certain time where they were seeing that the death just isn't happening, or they're trying to expedite the death or the dying. And so they broke the 2 legs of the thieves. But Jesus, they could see that he had already died. And so, not to say that these 2 thieves were such Hercules type of people to say, well, they were a lot stronger than Jesus, but I think, do you think that some of this why Jesus died more quickly had to do with all of the beating that took place prior to his crucifixion, the loss of blood, things, the pain?
I'm not sure, correct me if I'm wrong, but I'm not sure thieves would have carried a cross through a town. I don't know if that was a common practice. So Jesus had to carry the cross on his back, and people were doing things to him during that journey. So to have all of that done ahead of time, some people might have died during the trip to the crucifixion, I think. The fact that Jesus survived that alone, I think, is, just incredible. And then to be in such a weakened state, he probably didn't have a lot of strength to, like I was saying earlier, push his body up to open the lungs up away from the diaphragm so that he could get breaths. He probably just was further along than the 2 thieves who I'm assuming didn't have that type of treatment before their crucifixion. They probably were just brought in shackles to the site and then crucified.
Yeah. But breaking their legs, then that would then just really speed up the whole process then.
Yeah, what they may not have understood it at the time, how people died with breaking their legs, but probably what happens with that is if they're breaking the femur bones in particular, there's a lot of fat inside of the bones actually, And when you break a bone, like the femur, acutely like that, sometimes you can get what's called a pulmonary embolism, where a piece of fat goes up a vein and then goes into the lungs and blocks the lungs altogether. So it's a way to speed up the inability to breathe, I would suppose, at the time, although they probably didn't know that was happening. They probably just thought breaking the legs would just take the last fight out of the person, which I would assume it would. But if you think about it, if you break the legs, what can't you do? You can't push your body up to take a breath anymore. That's the other physiologic thing that happens, is you can't push your body up to take a breath, so you're done taking breaths. So it's just a matter of suffocating at that point. Yeah.
Here again, it just adds to how awful this
Yeah.
whole thing is. You know that, well, if you're not in enough pain, and having both of your legs broken would be extremely painful.
Right.
But then the idea that you just now can't get a breath. And
Yeah,
so
you're just hanging there, suffocating is what you're doing. Yeah.
And a big reason why they did this is that it was getting close to when the sun was going to set, and the Sabbath was coming, and they couldn't have anybody being crucified. I mean, all the bodies had to be down by the time
Right.
The Sabbath started. And so that's one of the things, is that when you look at religious customs, to say that, and that's part of understanding a lot of Jesus' crucifixion, is just seeing it in relationship to the religious traditions of the day and things like that. And so things had to be, as awful as this is, they had to take the proper measures to make sure that they didn't do anything that was improper as far as their religious religious regulations and traditions. And so that's another thing too, being a doctor, is that you probably have people with a lot of different religious persuasions, and so some religions probably say, well, we need to have this honored because this is part of who is. So what is the ethics with all that today?
Mostly there isn't anything that's terribly out of line with what we would do. For example, if you're near death, there isn't anything really restricting you from doing what you would do. I've actually never in my career run into a religious reason that I was not allowed to help treat pain or anxiety in the dying process. I've never been told that I couldn't do that. I assume there are people out there that may not want to have that and want to experience death through natural means, and that would be fine as well, as long as they were, getting what they wanted out of that situation. But I haven't really seen a lot of religious intrusion into the medical aspect of the dying part. I mean, obviously, there are people out there who have religious beliefs about blood transfusions and, transplants and things like that, that you can't do those things because of their religious belief, which, in many cases hastens their death, or, they feel that once they have a diagnosis, that's something that's inevitable that should not be stopped, and that's certainly a religious or philosophical decision on their part, and we honor that. We don't argue with it. There have been some legal court cases with children who aren't really able to speak for themselves in the case of dying and death, where religious convictions sometimes clash with what physicians are recommending, and we know about that by watching the news. But in the case of adults who are dying, there really isn't a whole lot to speak about that.
Yeah, so you don't run into these big ethical dilemmas too often.
No.
And for the most part, as long as I suppose it's within moral reasons, and you're, as far as being a doctor and things like that, what is healthy and what isn't, I suppose that you try to do what you can to honor whatever
Yes.
Final wishes would be, when it comes to, I suppose, religion, philosophy, or otherwise.
Yeah, occasionally, I would say I guess you could say the one philosophical difference I might have with some people is a lot of people don't want to utilize, if they've decided not to treat with chemotherapy, a cancer with chemotherapy, or heart failure with a hospitalization, and you're asking them to consider hospice as a method by which you can stay at home and have aides to help you and so forth. A lot of people resist that because they have a notion that hospice is admitting that you're dying, and it's a hurdle a lot of people don't want to jump over. That sometimes is a challenge, to convince people that hospice is there not only for right when you're dying, but also for before death. to aid with that process as far as the comfort part of it. Yeah.
It's a good program. Yeah. Now the soldiers pierced the side of Jesus. You know, they pierced his chest and out spilled blood and water
Yeah.
and so as far as that piercing goes, I mean, aside from the crucifixion, that would probably kill a person pretty quickly. And so, well, whatever. Could anybody survive a crucifixion and then have a sword pierce their side, their chest like this?
No.
Okay.
No, but what they're doing is, the lung is a bag of air, and so when you pierce a lung, you're generally deflating the bag. So it's like if you took a plastic bag and popped it with a knife. That's what you're doing with a lung. And so that lung that was providing air to Jesus was popped basically when that happened. The reason fluid came out is because when you're crucified and you have that struggle going on, I can only imagine that his lungs were starting to fill up with fluid as part of the trauma of what he was going through. So he might have stabbed him in a place where there was a lot of fluid in the lungs. That's why fluid came out. When you were mentioning that water came out of the lung, that made me think of what was called a pleural effusion, which is usually a clear, bloody kind of fluid that is sometimes amber looking that develops in people's lungs when they're undergoing severe stress.
Yeah, so in your estimation as a doctor, he certainly couldn't have survived this, that
No.
he was dead.
No
Well,
way.
that's, with the little time that we have right now, when is a person, I don't know if the term is legally dead, and who determines that?
Okay. Legal death is brain death. Determining brain death is not as scientific as you might think. There is a scientific way to do it with electrodes and brain waves, but no one really does that. Mostly it's no heart tones and no lung sounds. So a doctor can listen, or a nurse can listen, or a hospice employee can listen, and listen to the heart and the lungs, and if you hear no sounds at all, it is a way to declare death.
Okay.
Yes.
Well, this has been so very interesting, and so I really do want to thank you, Dr. White, for being on the program today and talking about the death of Jesus. It's been very helpful. And I want to thank all of you for joining us this day as well.